When you don't feel well, doctors may prescribe medication to manage your health. A study this May found 60% of Indianapolis neighborhoods are in a pharmacy desert, which is well above the national average, more than 30%. That means there's no pharmacy within a mile of these neighborhoods, like on the near northwest side.
The other drugstore, they closed it down at 38th and Illinois, CVS. They've been closing and reopening drugstores for the last 10 to 15 years.
So do you think it's easy to get to a pharmacy in this neighborhood?
No.
Why not?
Well, they moved away. You gotta go 5 to 10 miles out of the way to get something.
Been over here 42 years on the west side, and I've never seen a CVS or a Walgreens or no type of pharmacy.
So where do these Hoosiers go? For veteran Wendell Crenshaw, the VA mails him his medication. Otherwise, we mapped it out, and his closest pharmacy is about 2 to 3 miles away.
Adherence to medications has been a persistent problem.
Dr. Dima Cato, who coined the term pharmacy desert, explained to me the pandemic further impacted this health disparity.
I think during the early part of the pandemic with the testing, it became really apparent that, where do we go to get tested if the pharmacies are so far away?
The Raphael Health Center on the near north side knows the answer to this. It's in a pharmacy desert where many patients take the bus. We took the trip, and the easiest pharmacy to get to is either 3 or 6 miles away.
There was a wait at CVS and Walgreens. They were doing a great job, but they had waits. So then you can't wait because you've got to pick up your child or go to your job so you don't get tested. So that means you are incubating potentially or spreading. It's really bad.
I requested testing and vaccine data for 3 Indy neighborhoods considered pharmacy deserts. In all 3, less than 25% of the population had gotten a COVID test at some point. Nearly half of Marion County is fully vaccinated. Both Mapleton Creek and Crown Hill fell below that average at 44 and 32%. The Watson-McCord neighborhood was just above that average at 54%.
I think that healthcare delayed is healthcare denied. And so people aren't vaccinated because it's just hard to get there, to get the information you need.
In 2018, a bipartisan measure to study pharmacy deserts passed. 3 years later, I tried to track down what your elected officials discovered and proposed.
We did have an opportunity.
There was nothing because the study simply never went forward.
Over the next 3 to 4 years,
I asked a co-sponsor, State Senator Eddie Melton, why.
if it was assigned to a committee, sometimes the chair has the discretion on whether or not they're going to go forth with moving forward.
After our questions, Mr. Melton told me he plans to file some sort of legislation to readdress this statewide issue. That includes bringing pharmacy execs to the table.
I think we have to look at that model because many of them may generate their revenue more, not on the store amenities such as food and other services, but they're looking at how many folks are filling scripts. That's why having a study is critical.
And critical is exactly how residents describe the situation in their neighborhoods, now turned pharmacy deserts. Reporting in Indianapolis, I'm Birshal Edmay.
Fox 59 actually reached out to several major pharmacy chains to ask about their departures from Indy neighborhoods and if they will reinvest in our communities. You'll find that answer on fox59.com. That's also where you can use this interactive tool to learn if your neighborhood is a pharmacy desert as well. Birshal also did reports on racial and rural health disparities here in Indiana. You can find links to those stories with this web story as well.